Chapter 18, Blood, Screencast 4. Now, this screencast will be focusing on what is known as hemostasis. And what hemostasis is, it is the process in how bleeding stops. It is going to be broken down or made up of three overlapping phases, and they are 1, vascular spasm, 2, platelet plug formation, and 3, the actual coagulation or clotting phase. Now, vascular spasm, it's important to remember that the middle layer of blood vessels is vascular smooth muscle. And that's what's happening here. So vascular spasm is the process that occurs when blood vessels actually constrict. It's generally the first phase in response to injury to a blood vessel. It's designed to limit blood leakage. Think of it as clamping, and it can last from few to many minutes. Now, platelets and endothelial cells will release chemicals that further stimulate constriction. Greater vasoconstriction will occur when there is greater damage to the vessel. Now, the next phase is platelet plug formation. Normally, when uninjured, platelet activation is inhibited. Vessels' endothelial wall are smooth and coated with something known as prostacyclin. Prostacyclin is an eicosanoid that repels platelets. It causes endothelial cells and platelets to make cyclic AMP, which inhibits the activation of platelets. Now, when a blood vessel is damaged, a platelet plug is formed. It all begins when the collagen fibers in a vessel wall are exposed. Platelets will stick to collagen with the help of von Willebrand factor. Platelets develop long processes allowing for better adhesion, and then platelets aggregate together and temporarily close off the injury. Now keep in mind, a platelet plug is not a clot. This is a different enzymatic cascade. Now, when we look at the activation of platelets, the cytosol is going to degranulate and release chemicals. Chemicals such as serotonin and thromboxane A2, they are going to cause a greater degree of vascular spasm. Adenosine diphosphate, or ADP, and thromboxane A2, this will attract other platelets and facilitate their degranulation. So here's an example of a positive feedback mechanism. There are procoagulants that will stimulate coagulation, and then mitosis will be stimulated, substances to trigger the repair of the blood vessel. Now, there is a condition known as thrombocytopenia, and what this is a low platelet count. And this is an issue because it impairs all phases of hemostasis. Now, typically, platelet plugs form very quickly, in about a minute, but it's prevented from getting too large due to prostacyclin secretion by nearby healthy cells. Then we have the coagulation phase, and this is actually the clotting phase. And what clotting is, it's a network of fibrin, which is an insoluble protein, and it actually forms a mesh. And fibrin will come from the soluble precursor fibrinogen. And what this mesh does, it traps red blood cells, leukocytes, platelets, and plasma proteins, all in an effort to form a clot. Now, there are a number of substances that are involved in the coagulation process. Clotting is going to require calcium, clotting factors, platelets, and vitamin K. Clotting factors, for the most part, are inactive enzymes, and they are generally named in order of their discovery. Factor 1 is fibrinogen, factor 2 is prothrombin, and so on. The majority of these are actually produced within the liver. Now, vitamin K, this is a fat-soluble coenzyme, or vitamin, that's required for the synthesis of a number of clotting factors, and those are going to be 2, 7, 9, and 10. Now, some factors, for example, factor 7, are proteases that cleave other factors from inactive to active forms. Now, when we look at the initiation of the coagulation cascade, clotting starts with the intrinsic and extrinsic pathways. The intrinsic pathway, this is initiated by platelets upon damage to the inside of the vessel wall. a number of steps that are going to be completed in 3 to 6 minutes. The extrinsic pathway, this is going to be initiated by damage outside of the vessel. And this only is 2 steps and is active very quickly. Now, I'm not going to spend a lot of time focusing on the common pathway. We do want to keep in mind that it is a positive feedback mechanism that leads to the formation of a clot, and the clot stops once the fibrin fills the mesh, and extra fibrin will be destroyed by enzymes within the blood. Now, here what we see are the 2 intrinsic and extrinsic pathways, and they funnel into the final common pathway. What you're responsible for is that the intrinsic pathway will start due to damage in the inside of the vessel wall, whereas the extrinsic pathway, this is going to be initiated by damage to tissue outside of the vessel. Think of this as a typical cut, whereas the intrinsic pathway will be caused by damage to the inner wall, such as turbulent flow, atherosclerosis, and those mechanisms. They both funnel into the final common pathway. Now, what I want you to start with is going to be prothrombin. Prothrombin is inactive, and it is going to be converted into thrombin by prothrombin activator. Now, thrombin is necessary to convert fibrinogen into fibrin. And now we actually have the fibrin polymer and the ability to form a clot. Now, when we look at the sympathetic nervous system, it is going to be very much involved when there is a loss of blood. If it is greater than 10% of blood volume, the sympathetic nervous system will increase vasoconstriction, heart rate, and force of heart contraction. The thing to keep in mind here is the body is going to prioritize 2 areas, and those areas are the heart and brain, and that is where blood will be redistributed to. And when we look at the role of the sympathetic nervous system, it is very effective in maintaining blood pressure until 40% of blood volume is actually lost. Then we have to talk about how that clot is eliminated. And what this is going to involve is clot retraction and fibrinolysis. Clot retraction, this is when actinomycin, so protein within platelets, contracts and squeezes serum out of the developing clot, making it smaller. Then we have fibrinolysis, and this is actually how the clot will be degraded by plasmin. This begins within 2 days after the clot has been formed, and it occurs slowly over a number of days. Now, one thing to keep in mind here is we are looking at a balance between clot elimination and clot formation. And imbalances can actually lead to bleeding or blood clotting disorders. Damaged vessels, impaired blood flow, atherosclerosis, or vessel inflammation, they tip the balance towards clotting. So these are conditions where we will actually see clotting being promoted. Now, certain nutrients, ions, vitamins must be present for the clot to form correctly. Now, hemophilia, this is a bleeding disorder, and we have hemophilia A and hemophilia B. They're the most common, and they occur in X-linked recessive pattern, and this means that only males will exhibit the full-blown disease. Females will typically act as carriers, and this results from the deficiency of a number of factors. It could be factor 8, factor 9, or a much rare version is when factor 11 is missing. We've talked about thrombocytopenia. This is a platelet deficiency, and this results in an increased breakdown or decreased production, and it may occur in bone marrow infections or cancer. And also, there are certain drugs that actually interfere with clotting and can cause bleeding. So drugs such as aspirin, ibuprofen, warfarin, or ginkgo. Now, when we look at hypercoagulation, this is an increased tendency to clot. Now, the issue here is it can actually lead to the formation of a thrombus, And when that thrombus is dislodged within the blood, it becomes an embolus. Now, if that embolus becomes lodged in the lung, it will become a pulmonary embolism, and this can actually result in significant breathing problems and death. Now, also can have drug-related, environmental, and genetic causes. For example, hormonal birth control and prolonged inactivity can also result in the formation of a thrombus, and you may have heard of deep vein thrombosis. Now, hematopoiesis, this actually is the process that occurs in most bones in young children, and it is restricted to selected bones in the axial skeleton in adulthood. Now, when we look at older individuals, that red bone marrow is replaced with fat as individuals age. So it's not uncommon for older individuals to become more anemic. This is because they're producing fewer red blood cells. Also, they are producing fewer and less active leukocytes, and this is the reason why certain types of leukemia are more prevalent in the elderly than they are in younger individuals.